When the Rural Trauma Center received three critical patients from a highway pileup, the medical team knew they had less than 2 hours before severe weather would make helicopter evacuation impossible. Dr. Keller, the lead trauma surgeon, quickly assessed the first victim, a 67-year-old with multiple internal injuries who needed specialized care at the regional medical center over 90 miles away. Meanwhile, flight paramedic Jackson contacted the helicopter dispatch center, who warned that a narrow 90-minute window might be their only chance to fly before the approaching thunderstorm system arrived. Nurse Rodriguez worked frantically to prepare the stabilizing medications all three patients would need for transfer, knowing every minute counted in their race against the weather. The respiratory therapist had to intubate the second patient, whose chest injuries made breathing increasingly difficult, a delicate procedure they needed to complete before any helicopter transport could begin. The hospital administrator coordinated with the receiving trauma center, confirming they had surgical teams standing by and arranging for ground ambulances as a backup if the weather window closed too quickly. On the rooftop helipad, the pilot monitored the rapidly deteriorating conditions, calculating they would need to be airborne within 30 minutes or risk being grounded until the storm passed, potentially leaving the patients without the critical care they desperately needed. The charge nurse orchestrated the complex choreography of moving all three patients simultaneously toward the elevator that would take them to the helipad, carefully timing their departure to ensure maximum efficiency. As the first patient was loaded aboard the waiting helicopter, gusts of wind buffeted the helipad and lightning flashed in the distance, nature's stark reminder that their window for evacuation was rapidly closing. In a testament to the team's remarkable efficiency and determination, all three patients were successfully loaded and the helicopter lifted off with just 12 minutes to spare before the storm made flight impossible, beginning a tense 30-minute journey that would ultimately save all three lives.